Hello, Professor David. My name is Xingyu, and today I will do a presentation about how I support the creation of the implementation of safety consumption sites. Now I will start my presentation. First, I will explain what is supervised consumption sites. Supervised consumption sites and services are a controversial topic. According to the relevant information on the official website of Canadian government, supervised consumption sites and services can save lives and benefits the community. The government builds places for drug addicts and relevant staff is present to supervise, which can reduce the occurrence of dangerous events such as drug overdose and AIDS. In addition, these places are safe and clean and meet health standards. Next, I will go through a couple of advantages of these sites. Many drug addicts and drug abusers are hard to talk about these things. They often inject or smoke in secret places, which has serious potential risks. Supervised consumption sites and services can help them avoid these potential risks. According to the report of Health Canada, there is a lot of evidence that supervised consumption sites and services have life-saving significance, and it can help people in need connect with social services and serve as a way of treatment. The following 7 are the benefits of the Ministry of Health. First, reduce the risk of accidental overdose. Second, it can connect people with corresponding social services such as medical care, housing, and employment assistance. Third, provide corresponding medical services and treatment for people. Fourth, reduce the risk caused by the littering of waste drug equipment. Fifth, reduce the spread of infectious disease such as AIDS. Next, reduce the pressure on emergency medical services, which can help them focus on other emergencies. Seventh, provide people with corresponding medical environment, such as staff and peers, which can help people reduce drug abuse and then decide on treatment. Later on, I'll go through these points and then explain them. First, Canada is deeply affected by opioids. According to the research report of Ontario's HIV treatment network, there were 17,000 opioid deaths in Canada from 2018 and 2020, and they are increasing every year. This study shows that SCS places are conducive to the management of overdose and mortality reduction. Since the opening of Insight's SCS facilities, the number of fatal overdose cases has decreased by 35%, and the number of deaths has decreased from 253.8 to 165.1 per year. The death rate of overdose in other parts of the city also decreased by 9.3%. Second, according to the study, SCS has a significant effect on strengthening safe injection practice. Reliable information sources and then provision of sterile syringes can create a good community atmosphere. Third, research in Australia shows that SCS can effectively reduce the littering of abandoned medical equipment. During the 5-year study, it was found that numbers of syringes decreased by discarded by the public decreased significantly. Fourth, the study found that more than 100% of people received the detoxification services at the sense. Fifth, the prevention of the spread of infection diseases and the related economic benefits have a good impact. The Toronto government expects that each facility will avoid 164 cases of HIV infection and 458 cases of hepatitis type C infection, which will save 9.6 million Canadian dollars. In Ottawa, a facility can reduce 358 cases of HIV infection and 323 cases of hepatitis type C infection, which can save 80,000 Canadian dollars. Sixth, SCS did not lead to an increase in the crime rate. The data released by the Alberta government in 2008 showed that the police residence and the shops did not show an increase in the crime rate. Next, I'll explain how SCS helps reduce stress in medical institutions. Another serious impact of overdose is to increase the burden on the national medical system, such as BC province. According to the research of Mr. Pong, BC province is the province with the most serious case overdose, especially in 2015 and 2016, in which the death toll of overdose increased 5 times. In December 2016, BC province opened several OPS and SCS places. Although the research cannot show the hospitalization rate of mortality rate can be reduced, the research shows that the opening of these places has reduced the burden of medical systems, such as the attendance rate of nursing staff and the emergency department visits rates have decreased significantly. In this study, researchers clearly stated that at the beginning of the establishment of SCS sites, the visit rate and the emergency department increased, but then did decrease by 3%, and finally decreased by 39%. In conclusion, SCS can reduce medical pressure and relevant nursing staff can serve other emergencies. On the next page, I'll explain how it reduced the death and access. The impact of SCS is very extensive, and the most important purpose is to reduce the death and emergency cases caused by overdose. According to Catherine, 80% of the respondents are willing to use SCS services. In addition, more than 67% of people who take drugs in public every day have gone to SCS every day. So most high-risk people will choose SCS, which can reduce death case and overdose case. In conclusion, ICS plays an important role in the healthy development of community. Next, I'll explain how SCS strengthens social equal treatment. First, in the current society, drug addicts are unpopular in mainstream society, and many people will exclude them, which leads to many drug addicts unable to obtain employment and homelessness, which can be regarded as potential discrimination. SCS can help them regain equal social treatment, such as detoxification, getting jobs, and applying for subsidies. According to Kerman, drug users will experience a lot of unfair treatment called SDOH inequality. This inequality include homelessness, food problems, and the difficulty in accessing healthcare. This study confirmed an important theme. In the experiment, most participants believed that SCS was a place for drug addicts to stay connected with the world, where they felt the warmth of home. Most drug addicts are basically lonely and then desperate, and SCS will make them feel like community care. One participant said that without SCS, her friends would die more. In addition, most drug addicts will feel society isolated, but they will feel a normal social environment in SCS where there will be no discrimination and isolation. Finally, SCS gives these people a sense of security and is a refuge. To sum up, ICS can help special groups obtain social contact, emotional support, and a safe and stable residence, which has a positive impact on the society. ICS ensures equal social treatment. Next is the summary. After all, SCS should be supported according to its advantages, such as reducing death, overdose, medical pressure, infectious disease, and littering. Moreover, it can also improve social equality. In general, the advantages of SCS are obvious to all. In addition, according to the current situation, it is difficult for us to stop drug abuse and drugs from the source, but we can reduce the risk brought by these problems from other aspects. No one wants to be affected by these problems, so they are all victims. SCS is an important process which can make our lives healthier. This is my presentation. And on the next page, this is the 5 reference that I have quoted and appeared in my presentation. Thank you so much for watching. Have a good day.